Let's bring in Dr. Aditi Nerurkar now. She's a physician at Harvard Medical School. Doc, Georgia just announced that it's opening vaccinations up to everybody 16 and up right now. Is this the right way to go about this?
Yeah, it's a great step, very promising. Georgia and Texas are the latest states to open up vaccinations to 16 and over. Prior to that, states like Alaska and Mississippi were one of the first, West Virginia, Utah, and Oklahoma as well. So we know that the Pfizer vaccine is for 16 years and older, and the Johnson & Johnson and Moderna vaccines are for 18 years and older. The more people we can get vaccinated, the quicker we can get this pandemic under control.
As states expand eligibility, though, are you concerned at all about supply matching the demand as they increase these groups that are eligible?
You know, at the start, when we were first rolling out the vaccines across the nation, supply was a major issue. Now we're seeing a boost in the number of vaccine doses that we have available. There is regional differentiation. So, for example, in the southeast of the U.S., we don't have much of a demand. In fact, the demand is quite low based on the supply. So many more people can get vaccinated very quickly versus places like the Northeast, where the demand is quite high, supply is steady. So there's a real variation region by region across the U.S. But our hope is that in the next several months, with the vaccine supply going faster and faster, we will be able to vaccinate nearly everyone who is eligible. Though at the start, we had to be very careful and cautious and vaccinate only those who are at the highest risk. Now we're opening it up to more people, and that's really promising.
Yeah. The CDC director said this morning that 1 million teachers are now vaccinated through the federal pharmacy program. How can they still sort of stay safe in the classroom even after being vaccinated?
You know, classroom safety is something that people have been talking about for a long time. Initially, at the start of the pandemic, we were all worried whether kids were as impacted as adults. The studies have really been panning out that kids are less affected, have less severe disease. And so that is very reassuring. It's wonderful that teachers are getting vaccinated. And most recently, the CDC did issue a statement that in certain parts of the country, they're okay with shortening the distance of separation from 6 feet to 3 feet. Of course, we have to take in regional considerations, whether the school is urban versus rural and crowding. Other things to consider is it a hybrid program, which has moderate risk? Is it fully in person, which has the highest risk? And of course, low risk is Zoom classes, etc. But it is a very wonderful development that's happening.
All right, Dr. Aditi Nerurkar, we appreciate your time today. Thank you.
Thank you.